Of course, different surgeons are going to have different opinions, and this is, of course, only my opinion. In general, I would want my patient, if possible, to stick around for about 3 days. The risk of having a bleeding complication after a breast reduction is small, but it's not zero. If you were going to have that kind of problem, it would generally happen within about 3 days. So I would want my patient to stick around for 3 days after having their breast reduction. Also, since it's a little bit of a longer procedure, it takes about 2.5 hours or so, I would recommend they take a baby aspirin about an hour or two before they fly, if they have a long flight. If just an hour or two flight, it's not necessary, but if they were flying, for example, over to Europe, or it's a 6-hour flight, I'd suggest to take a baby aspirin. The risk of bleeding after 3 or 4 days after surgery is extremely small, and this would have very little impact. Otherwise, I think it's perfectly fine to fly after about 3 to 4 days after your breast reduction.